Hello, everyone, and welcome to a special edition of Special Education News and Noteworthy. I'm Paige Fitzgerald, and today we're taking a deeper look at a major announcement from the Trump administration that has generated significant discussion across the special education community. A quick reminder before we jump into the news. If you can take a moment and follow us on Spotify, if you aren't already, and rate us 5 stars. It helps other families and advocates find us, and it helps us on our mission of making special education news accessible for everyone. All right, let's get right into it. On June 16th, the Department of Education announced plans to move the Office of Special Education and Rehabilitative Services, commonly known as OSERS, to the Department of Health and Human Services, while shifting the Office for Civil Rights into a partnership with the Department of Justice. Since the announcement, I've spent time reviewing the original reporting, the Department of Education statements, responses from disability advocacy organizations, and reactions from parents, attorney, and policy experts. I'm not here today to tell you what to think about this because I think it is so important that everyone should really form their own opinions based on what they are reading, seeing, and feeling. But my point today is to help everyone try to understand what happened, why people are reacting so strongly because they are, and what questions families should be asking to move forward. So let's dive right in about what happened. So the Trump administration announced that 2 major functions currently housed within the Department of Ed will move to other federal agencies. First, the Office of Special Education and Rehabilitative Services would move to the Department of Health and Human Services. OSERS, as it's called, oversees many of the federal responsibilities connected to the Individuals with Disabilities Education Act, or the IDEA. This includes monitoring state compliance, distributing federal special education funding, providing guidance to states and districts, and supporting programs related to transition services, employment, and independent living. Second, the Office for Civil Rights, or OCR, would partner with the Department of Justice. So OCR investigates complaints involving disability discrimination, which includes Section 504 violations, racial discrimination, sex discrimination, and other civil rights issues that affect students. The administration says these changes are intended to improve coordination, strengthen enforcement, and reduce bureaucracy. But the announcement immediately sparked concerns from many disability advocacy organizations. So first things first, what hasn't changed? So before we talk about the debate, let's address the question that many families immediately asked. Because when big changes happen, there are big reactions because there's a lot of uncertainty. So quick fire, is IDEA going away? No, it is not. Are IEPs going away? No, they are not. If your child has a 504 plan, or Section 504 protections going away? No, they are not. Do students still have their rights to evaluation services and FAPE, aka a free appropriate public education? Yes, because those legal protections are still remaining in place. The federal law hasn't changed. So your child's IEP is still legally binding, and schools are still required to provide special education services. Students still have the same legal rights that they had before this announcement. So let's take a deep breath right there because I feel like that's an important place to start from. So let's go into what the administration is saying. Education Secretary Linda McMahon released a detailed statement explaining why the administration believes these changes are necessary. According to McMahon, she and her team spent months meeting with parents, educators, special education directors, and advocates. She acknowledged that many families described a system that often feels difficult to navigate. Parents reported struggling to obtain services, fighting lengthy battles over supports, and spending significant time and resources trying to secure what federal law already guarantees. McMahon is arguing that these changes are intended to address those frustrations. According to her, the administration believes that placing special education oversight closer to HHS could improve coordination between educational services and other disability-related supports. They also argue that partnering OCR with the Department of Justice could strengthen civil rights enforcement by combining expertise and resources. The administration has repeatedly emphasized that IDEA remains law, funding will continue, and students' rights are not changing. Their position is that this restructuring will reduce bureaucracy and ultimately improve outcomes for individuals with disabilities. But here's why so many advocates are concerned. While the administration describes this as an improvement, many disability advocacy organizations strongly disagree. In fact, some of the participants that were at those roundtable sessions reacted to her statement by saying, Okay, you clearly didn't hear us, as your statement says, because we explicitly asked you not to do this. One of the common things around statements from organizations like COPA and the ARC is that IDEA was intentionally created as an education law. Advocates are pointing out that IDEA exists because students with disabilities were historically excluded from schools, denied educational opportunities, or placed in institutions. For decades, disability advocates have worked tirelessly to move away from viewing disability solely through a medical lens. Instead, IDEA focuses on educational access, inclusion, participation, and opportunity. Many advocates worry that moving special education oversight into HHS could unintentionally shift the focus back toward a medical model of disability. In other words, they're worrying that students could increasingly be viewed as patients receiving services rather than students accessing an education. Whether that concern ultimately proves true remains to be seen, but it has become one of the central objections to the proposal, and it's based on things that have happened in the past of people with disabilities being institutionalized. So, did the administration actually listen to families? This is what we just touched on briefly, but it's one of the major points of disagreements because it goes against what they are claiming to have done in making this decision. The administration is pointing to these conversations that they had at these roundtables as evidence that families wanted change. Yes, we did want change. However, many advocates who participated in those sessions say they never recommended moving special education oversight out of the Department of Ed. Several organizations, including the ARC and the Center for Learner Equity, have stated that families consistently discuss challenges accessing services, delays, staffing shortages, and enforcement concerns, but they argue that no one was asking for OSERS to move to HHS. As one advocate put it, families described problems with the system, but they never described this as the solution. This is such an important distinction because as the narrative is being crafted and played out that this is what people were asking for, it was not what people were asking for. There was a decision that they had decided to make months ago, years ago, right? A year or so ago. And they were looking for ways to justify this decision, is what proponents for keeping special education within the Department of Education are saying. So let's talk about an issue that repeatedly surfaced in the responses from advocates, and that is the issue of fragmentation. Currently, many of the offices responsible for special education oversight, compliance, and civil rights enforcement operate within the same federal department. Under the proposed structure, special education would move to HHS, civil rights would move to the DOJ, other education functions would go other places, some already have. Advocates worry this could make an already complicated system even harder for families to navigate. One parent interviewed by Chalkbeat described it this way. Families already spend an enormous amount of time navigating schools, healthcare systems, insurance systems, and government agencies. The concern is that splitting responsibilities across multiple departments will just create additional confusion when families need help and are already confused. One of the most interesting perspectives came from an Associated Press article that interviewed parents and advocates currently working within the system. The article highlighted something important. Many families already feel the system isn't working particularly well. Parents described civil rights complaints sitting unresolved for years. Advocates were discussing growing backlogs. Attorneys are describing relying more heavily on state systems because federal investigations have slowed significantly. And this doesn't necessarily mean that they support the administration's proposal because most of them do not. In fact, you're really hard pressed to find people that are working within the world of special education that do support this. In fact, most parents and advocates are saying that they're concerned about the changes, but it does add an important layer to the conversation. Many families aren't comparing this proposal to a perfectly functioning system, right? We all know that the world of special education, it needs improvement already. And that's an important piece of context because yes, we are asking for change. We're asking for improvement, but we're not asking for this. No matter how people are trying to twist it, we are not asking for this. So after reviewing all these perspectives, right now, as this shift is happening, the question isn't will students lose their right? Because as of now, those federal laws are still in place. Their rights are still protected. But can special education oversight, disability rights enforcement, and educational accountability remain effective when those responsibilities are going to be divided across multiple federal agencies? Of course, the administration is saying yes. But many disability advocacy organizations are saying no. The administration is arguing the move is going to improve coordination, while advocates are saying it's going to create more fragmentation. The administration is saying that it's going to strengthen enforcement, but advocates, of course, are worried about the weakened accountability. And administrations say that families will benefit. But many advocacy organizations are feeling the opposite, that families could just face more confusion. And this is really where the debate is unfolding. So, what should families watch for next? At this point, there are several important questions that remain unanswered. Will Congress challenge the move? Will legal action be filed? How will responsibilities be divided between agencies? Will complaint investigations continue without disruption, as they're already currently backlogged and you could argue already being disrupted? Will schools receive consistent guidance? This is something where in the past, in so many ways, when things trickle down, often local districts are left to kind of suss out, okay, what do we make of this? How do we implement this? And states as well, I'm sure, are also up in arms and extremely confused about this. But perhaps most importantly for us today, will families notice any changes in how they access services, file complaints, or receive support? So these are the questions that are going to determine whether this restructuring improves the system or creates new challenges. For now, the most important things families should know is this: your child's rights under the IDEA, Section 504, and federal civil rights laws remain in place. The debate that we're seeing today, thankfully, is not challenging the fact that those rights exist. Right now, it's trying to figure out who should oversee them and how those systems should function moving forward. So as always, we'll continue monitoring developments and sharing updates as more information becomes available. If you found this episode helpful, please take a moment to follow this podcast on Spotify and share it with another parent, educator, or advocate who may be trying to make sense of this news. Thank you for spending time with me today. Next week, we'll be back into our regular format of our top 5 stories of the week. Until next time, stay hopeful, stay vocal, and take care of yourself. Bye, everyone.